Hello, everyone. Welcome to the EMPACT-Us Suite of Tobacco Treatment Services Primary Care Training. I am Dr. Ji Liu, Family and Integrated Medicine Physician and Research Scientist at Family Health Centers. Along with Dr. David Strong at UC San Diego, we are the co-principal investigators of this study. We are tobacco treatment researchers funded by the Tobacco-Related Diseases Research Program. We are here asking for your help to carry out an intervention in the primary care setting to help our patients who are tobacco users to quit. Our study is called EMPACT-Us, Enhanced Multi-Component Proactive Navigator-Assisted Cessation of Tobacco Use in Low-Income Populations. Sound like a lot of work? Don't worry, we know you have so much to do already. We are not asking you to take on another different task. We're just providing a formula for you to be more intentional and efficient about the way you approach the topic of tobacco treatment with your patients so that they have a better chance of quitting and improving their overall health, prevent cancer, live longer, better through increased engagement in tobacco treatment and quit attempts, and ultimately sustained cessation. If you've ever felt like you go into the exam room with a patient, take their social history, document their tobacco use history, and then perhaps have 10 seconds to ask if they're interested in quitting or curbing tobacco use, but then run out of time, you're not alone. Or perhaps you prescribe a nicotine replacement patch or gum and not sure if a patient is able to get them from the pharmacy, uses them at all, if they're using it correctly, and then a year later they come to an appointment still smelling like cigarettes. So frustrating. We know there's just too many priorities in a primary care appointment to fully address tobacco use. So we gathered all the available resources, updated them to current evidence-based standards, and packaged them so that they are easier for patients to access and for you to quarterback. Changes have already been made over the past 2 years in our EHR, and you may already be using some of the features. The EMPACT-Us suite of tobacco treatment services include medical assistant data collection through the Interact rooming process to provide you information on patients' smoking status and desire to quit, a redesigned EHR smart phrase to guide you through the tobacco treatment-related appointments if you choose to use them, updated medication prescribing instructions and referral order sets in the EHR under the tobacco user order set, updated decision aid on lung cancer screening based on the latest U.S. Preventive Services Task Force guidelines, direct referrals to Kick It California, formerly the 1-800-NO-BUTS number, otherwise known as the California Smokers Helpline, a revamped health education smoking treatment program at Family Health Centers, and an emphasis on placing the follow-up appointment in primary care just for tobacco treatment that gives you and the patient more time to focus on this one important issue. We have short training videos that are 1 to 3 minutes long that we will show today and will email you later this week on the points of intervention in the primary care setting, so you can always reference when you need to parts of the EMPACT-Us tobacco treatment suite of services. We hope that after you learn more about the available services for tobacco treatment for your patients, you feel more confident in your prescribing and referral practices and in the way you can counsel patients about tobacco treatment. An extra bit of support that your patients will receive after you see them for an appointment that involves a discussion of tobacco treatment are a series of text messages that serve as reminders to continue to engage on their quit journey. In these text messages, they will be asked about their tobacco use status. Their answers, however, will not be linked to their medical chart, but will be used for quality improvement purposes. Some of your patients will also receive a survey about their opinion on the suite of tobacco treatment services. Their answers are de-identified, and results will only be analyzed in aggregate. If your patients have any questions about these components of the study, feel free to pass them on to us at quitstudy@fhcsd.org. We will now view these training videos together and answer any questions at the end.
Today we'll talk about the tobacco use order set and smart phrases. Tobacco treatment includes tobacco treatment medications as well as behavioral counseling. Let's take a closer look to see what the tobacco use order set functions are. When ordering tobacco treatment medications, the order set guides you through a nicotine replacement step-down therapy and dosages needed to help your patients succeed in their quit attempts. And to help you order these medications, we have another video called How to Order Tobacco Treatment Medications. Scheduling a telehealth follow-up visit focused on tobacco treatment in 2 weeks or in 1, 2, or 3 months. We highly recommend it for patients who start on tobacco treatment to receive a follow-up visit. Placing referrals to KICA California, formerly known as the California Smokers Helpline, or the FHCSD Tobacco Treatment Support Program. We will tell you a little more about each one in later blurbs. By the way, research shows that combining behavioral counseling with tobacco treatment medications to curb cravings has the best evidence for success, providing smoking treatment resources and education to both the patient and the provider. You may also use the tobacco use order set to order a lung cancer CT screening, clinical reminders and after-visit summaries and advisories, and you can also easily load into the SoapNote tobacco treatment smart phrases to save you time on documentation. It's that easy. If you have any questions, please don't hesitate to reach out sending an email to quitstudy@fhcsd.org. Thank you for watching and stay tuned for more short videos. These are the 2 available programs to refer your patient for tobacco treatment counseling: KICA California and FHCSD Tobacco Treatment Support Program. Research shows that combining tobacco cessation medications with behavioral counseling increases the chances of success. You and your medical assistant can refer patients to KICA California through an electronic referral process. This means that the patient won't need to do anything other than answering a phone call from a KICA California Quit Coach within 3 days after placing the referral. But what is KICA California? It's formerly known as the California Smokers Helpline, or the 1-800-NO-BUTS number. KICA California is a free statewide program funded by tobacco taxes that helps Californians quit smoking with the help of proven science-based strategies. It's available to everyone in California and is offered in multiple languages: English, Spanish, Mandarin, Cantonese, Korean, and Vietnamese. And KICA California also offers cessation counseling to quit vaping and smokeless tobacco. But what if your patient would like to stay within family health centers? Our FHCSD Health Education Department has a tobacco treatment support program. After placing the referral, your patient will be contacted by a patient service representative within 3 days to schedule an individual appointment with a health educator for tobacco use and readiness initial assessment. If the patient is ready to quit, they will be connected to a tobacco treatment support program facilitator who will conduct the sessions with an adapted, evidence-based tobacco treatment curriculum. These are free year-round smoking treatment sessions. The goal is to offer group sessions over the phone, but if the patient prefers a one-on-one session, it can also be accommodated. And finally, our health educators provide the services in English and Spanish. Don't forget that having the support of the primary care provider and someone to coach the patient through behavioral changes on the same journey increases the chances of quitting for good. The benefits of referring your patients to tobacco treatment programs? It increases quit attempts and prevents relapses. And while a single session can be efficacious, multiple sessions even more so. If you have any questions, please don't hesitate to reach out sending an email to quitstudy@fhcsd.org. Thank you for watching. The tobacco use information that EMA collects and interacts during the rooming process will be displayed in the EHR dashboard. You will see the patient's smoking status and quit date, if one was set, displayed above the soap notes. Patients who have tobacco user on their problem list should get asked every visit if the status has changed, and the ones who don't have it are asked every 11 months. If a patient sets a quit date through a tobacco treatment support program like KICA California or FHCSD Tobacco Treatment Support Program, or if your MA updated the quit date, you'll see it displayed here. These programs are explained in the video titled Tobacco Treatment Counseling Programs, KICA California and FHCSD. These status updates may prompt you to discuss whether the patient needs additional behavioral support and/or pharmacologic options for their cessation efforts. Keep in mind that the likelihood of a successful quit attempt is increased if counseling is provided along with the medications. If you notice that the patient's tobacco use information collected by the MA is not up to date, Prior to closing the encounter, you will be able to update this information under the Info tab. Scroll down until you see the Substance Use section and click on the respective fields to input the updated information. If a new quit date is created, it will be updated when the page is refreshed. This allows you to have accurate information to work with in future visits. In addition, this vital information goes into the EHR's Decision Aid function, and it helps the patient receive the most appropriate care for things like lung cancer screenings. And finally, during your clinical encounters, you may use a smart phrase that can be loaded to the SOAP note to help you save time on documentation. Feel free to reach out if you have any questions and send us an email to quitstudy@fhcsd.org. The two main types of tobacco treatment medications to help your patients control their cravings are nicotine replacement therapy, NRTs for short, and non-nicotine medications. Many studies have shown using NRTs can double the chances of quitting smoking, and that combination therapy appears to be more effective than monotherapy. Combination therapy should be offered to patients as first-line pharmacotherapy. Although some of the medications may not be covered by insurance, they can be obtained over the counter. This may require discussion with your patient. Let's go into the EHR. Click on the problem list, go to the tobacco user orders set, and focus on the tobacco treatment medications list to check recommended combinations. When it comes to nicotine patches, they are prescribed based on the typical number of daily cigarette use, and they come in a nicotine system kit or in single dosages. The order set in EHR provides one option for prescribing based on daily use. It is possible to meet your patients where they're at, as oftentimes the standard dose is not enough to curb cravings, and we recommend for more than 1 pack per day, 21 milligrams a day for 6 weeks, then 40 milligrams a day for 2 weeks, and then 7 milligrams a day for 2 weeks. And for less than half a pack per day, 14 milligrams a day for 6 weeks, then 7 milligrams a day for 2 weeks. Oftentimes, your patients will require a higher dose. If they report cravings, consider going up to the higher dose of nicotine patches than what they are currently on, or discuss combination therapy. The first combination is a long-acting NRT plus a short-acting NRT, which is used as needed. The patches are prescribed based on the typical number of daily cigarette use. Use the gum and lozenges as PRN breakthrough treatment. Combine the patches and the gum. The gum can be used based on the time to the first cigarette of the day. Less than 30 minutes, 4 milligrams. More than 30 minutes, 2 milligrams. And or the quantity of the cigarettes a day. More than 20 cigarettes a day, 4 milligrams. And less than 20 cigarettes a day, 2 milligrams. You can also combine the patches with lozenges. The dosage is the same as for the gum, and is also based on the time of the first cigarette of the day and or the quantity of the cigarettes a day. And please remember to look up usage instructions and inform your patients as needed. The second combination is NRT plus oral non-nicotine medication. Combine patches and bupropion. We recommend 150 milligrams once a day for 3 days, then 150 milligrams twice a day for 4 days, then, on quit date, and please set one with the patient, stop smoking and continue 150 milligrams twice a day for 8 to 12 weeks. Additional 12 weeks may be considered, and there's no need to taper. Or combine bupropion as above, plus nicotine gum or lozenges, as explained previously, for acute cravings. The third and last combination is an NRT plus oral non-nicotine medication. Combine the patches and varenicline and prescribe the starter dose and the maintenance dose. 0.5 milligrams once a day for 3 days, then 0.5 milligrams twice a day for 4 days, then on quit date, and please set one with the patient, stop smoking and take 1.0 milligrams twice a day for 11 weeks. May continue for additional 12 weeks. Please remember to discuss contraindications and side effects with your patients. If you have any questions, please don't hesitate to send us an email to quitstudy@fhcsd.org.
From published studies, as well as interviews conducted with our own patients at FHC, we found that patients most value what their PCP has to say about the impact of tobacco on their health. Armed with this knowledge, our hope is that you feel more empowered to utilize these available services and introduce them to your patients who are smokers who wish to quit. A tiny shift in the way that you speak to your patients about tobacco treatment may make a huge impact on how they change their behavior and subsequently their health for the rest of their lives. Thank you for your time and efforts. We appreciate all that you do.